Welcome to Adapt NCLEX. Today I'm breaking down 10 labor and delivery questions based on concepts that keep on showing up on the NCLEX. They keep on asking over and over and over. We're going to talk about stages of labor to fetal monitoring. Let's jump in. First question, this is testing your critical thinking, but don't worry about it. I will break it down in the way that it become easy. And I want you to work with me as we go through. Take a pen and paper and walk through the way I'm going to approach the question. How do you answer the question? Read it from the back. What is the next priority action? So I'm going to underline it. And I said priority action. I'm going to put a star over here like that. So that's the priority action. That's what I'm going to do. Now, what is the question asking us? After epidural anesthesia is administered, the client blood pressure dropped from what? 120/80 to what? 86 to 60. The fetal heart rate dropped to what? 90. That's the question. Now read the answer choice. Reposition the client to a supine position, increase IV fluids and administer oxygen, notify anesthesia provider, and prepare for emergency C-section. I want you to stop the video, think about it, go through each process, find your answer, and then replay the video. This is the way I would do it if I'm taking the NCLEX. First, look at the question being asked. The question being asked is this: next priority action. That means any of this can be right, but you got to pick one that will lead to prioritization of the patient. One. That's the next thing. Then look for the buzzword. Patient had what? Epidural anesthesia. Then what happened? Blood pressure dropped from what? 120/80 to this. Patient is now what? Hypotensive. The baby heart rate is also dropping because the mommy blood pressure is also dropping. So we have fetal bradycardia and what? Maternal hypotension. What do you think? It's a prioritization. Which one should you do? Reposition the client in a supine position, increase IV fluid and administer oxygen, or notify the anesthesia provider, followed by C-section? The right answer is number 2. And let's break it down. We're going to look at each answer choice and think about it. What is the main problem? The main problem is maternal hypotension. How did it happen? After epidural. How does epidural causes hypotension? Vasodilation. What is vasodilation? Your vein and your arteries are get bigger and there's loss of blood in the system, but you're not losing it. You're basically less blood going to the circulation. So how can you fill the tank? By putting in fluid in the tank. I know a lot of people will pick what? What do you think they will put? Putting the mommy in the position. But look at the word in the position. Supine position. You never put a pregnant lady in the supine position. So changing position is fine. But in this situation, even if it's lateral, it's a wrong answer. This says supine, so definitely wrong. Notify anesthesia provider. You can do something. Therefore, this is wrong. Prepare for emergency C-section. Patient has hypotension. It's not stable to go to surgery. Therefore, this is wrong. Therefore, what do you need to do? The veins are bigger. Fill the tank to help with the hypotension. Maternal hypotension is due to vasodilation. Therefore, we should fill the tank, which is uretroplacental perfusion. That's why the baby heart rate is dropping. Is due to what? Maternal hypotension. Therefore, fill the tank. This is the first one. The cases get harder and harder and harder. But we will get through as together. This is the second one. It's an NGN. I want you to take a pen and paper. Write everything I'm going to talk about. I'm going to break it down, but this concept, you have to know. You have to know. Once again, these are numbers that look intimidating, but I know you'll get it. What is the problem? Read the question from the back. Which assessment finding is concerning and not concerning? This is NGN way of asking the question. The nurse is monitoring a client at 37 weeks gestation in labor receiving Pitocin. So the question It's about patient receiving Pitocin. Which of those do you think is concerning or not concerning? We're going to break it down. 6 contraction in 10 minutes. Think about it. Resting tone is 20. 3, frequency of contraction at what? 3 minutes. Duration of contraction, 60 seconds. Fetal heart rate drop at the beginning of the contraction. And maximum contraction is what? 80. These are numbers associated with fetal heart monitoring. And you have to be comfortable with them when you see them. Don't worry about it. We're going to go through. The key with maternal contraction and fetal monitoring is these numbers you have to know. There should be no more than 5 contractions in 10 minutes. We have 6 contractions in 10 minutes. That's wrong. This is concerning. Resting tone has to be what? 20. That means when the mommy is not contracting, this is the pressure we want the uterus to be. Otherwise, it's going to rupture. Therefore, this is not concerning. The frequency of contraction is what? At 3 minutes. That means if mommy contract 1, the next time you contract will be 3 minutes. We need at least 2 minutes. So 3 minutes is what? Longer than 2 minutes. Therefore, frequency of contraction is not concerning. The duration of the contraction is at 60 seconds. That means from here to here is 60 seconds. The key fact number you should write is you should not be more than 90 seconds. This is 60, so we are good, right? Fetal heart rate drop at the beginning of the contraction. This is what we call early deceleration. It's not a problem. The maximum contraction is at what? 80, right? That is the maximum you should go. That number, you should know it. That is also not concerning. So the only thing in the case is what? 6 contraction in 10 minutes is unacceptable. So which finding is concerning? That's those numbers you should be comfortable with. Those are the numbers the NCLEX will ask you. I put it in a table form to make it look like it's hard, but know these numbers. 5 contraction in 10 minutes is okay. 20 resting tone is okay. Frequency of contraction should be at least 2 minutes. Duration of contraction should not be more than 90. Fetal heart rate dropping, early deceleration is okay. It's due to what? Head compression, right? But that's fine, right? Those are okay. Late deceleration is bad. This is number 3. And then should include assessment for what indicator of an adverse drug effect. Sometimes you see these NCLEX questions that the wording look a little bit confusing. We're going to break it down and I'll show you how to find the answer. A nurse is caring for a client receiving what? Terbutaline to prevent preterm labor. The nurse should include assessment for what indicator of an adverse effect. 1, temperature every 2 hours. 2, deep tender reflex every 4 hours. 3, fetal heart tone every 30 minutes. 4, assess for cough every 4 hours. Like I said, stop the video. Let me know your answer. Put it down in the comments when you get it. But what do you think? Let's break down the question. And let me know your answer that you pick. Let's go back. The next should include assessment for what? Indicator. This word is very important. Indicator of what? Drug effect. It means we want to know if the medication is causing adverse effect. That's all. What medication? Look into the stem of the question. You see terbutaline. What is it being used for? Preterm labor. Preterm labor. Therefore, I'm dealing with terbutaline. What is terbutaline? I ask myself. Terbutaline is what? It's a beta 2 and beta 1 agonist. That means it's going to affect your lung, that's beta 2, and B1, that's your heart. What is its major side effect is going to increase your heart rate. 2 is going to cause pulmonary capillary dilation and bronchodilation. It allows more fluid in your lung. Major side effect is pulmonary edema, cardiac arrhythmia. And so those are the 2 things. When you see a beta agonist, that's what you want to worry about. Another thing you should worry about is electrolyte. So every time you see beta agonists, those are the things you have to worry about. Now, let's look at the answer choices that are wrong. Temperature of what? Every 2 hours. Of course, we're going to check your temperature, but it's unrelated to terbutaline unless we give you a really, really high dose. So this is wrong. Reflex, a lot of people will pick this because every time you're dealing with labor and delivery, you worry about reflexes because of probably patients on what? Magnesium. We're talking about terbutaline. It's not the same thing as magnesium. Fetal atone every 30 minutes is part of your labor. There's no indication in the question that we worry about the baby. The terbutaline effect is mostly on the mother, on the uterus to slow it down. When you slow it down, baby heart rate become normal. Of course, you're going to check it every, 30 minutes. The right answer, like we said, cough. But why cough? Because it leads to pulmonary edema. You can have CHF. So I don't want to write CHF there. I put cough there so that you can see when you see questions like that, you can see that sometimes this is the way they will frame it. You know the answer, but the answer choice you're looking for is not there, but it's there, right? Cough is the same thing as what? Pulmonary edema. Therefore, I said tachycardia, pulmonary edema, and arrhythmia are the major side effects of beta agonists. And this is the way you should remember it. Every time you see beta agonists, especially those with beta 2 effect, watch for your lung, your heart, and electrolyte, which is what? Potassium. So we've recapped a bunch of concepts. We know about terbutaline. We talk about some of the contractions and factors that we need to know. Now we're going to apply it in the subsequent question. This is number 4, another NGN. Don't worry, I got you. Which finding indicate that the client is in what? Transition phase, underlying transition phase. And then assess the client in labor. What do you think? Look at it carefully. Don't worry. Take the box out of it and rewrite the question in the normal way without the NGN style. Next generation way. What? Cervix, 8 to 10 centimeters dilated, 80 to 100% effacement, Ferguson reflex, contraction every 2 to 3 minutes apart, and moderate contraction. Try it and let me know what you think. But this is the way I teach people when we do labor and delivery. This is the way I want you to think about it. Draw a line and know that stage 1 is the biggest. And stage 1 has 3 phases. That's all. And you want to get to 10 centimeters and 100% efface. Therefore, the only way you can get to there is to divide yourself into 3. So maybe 1 to 3, 3 to 7, or 8 to 10. That's all. And the percentage, you do the same thing, 0 to 30%, right? 30 and 40 to 70%, and 80 to 100. Therefore, we know this is the transition. Then you have to know a little bit of the things and what is happening. Cervix is what? 8 to 10 centimeter dilated. Look like it's good. Transition phase, right here. 80 to 100% efface. Well, you're almost closed. It should be fine. Ferguson reflex, what is that? Ferguson reflex is the strong edge to push. How do you going to have a strong edge to push? Except when the baby is all the way down and is pushing down in the pelvis, about to come out. And that is when you are in what? What do you think? When you are in what stage? Transition phase. You're almost about to come out. That is the transition phase, not the active phase. This is the transition phase, strong edge to push. Contraction are very, very short, like 2 to 3 minutes, they come in together. And what do you call it? The contraction, if they're so close to each other, they cannot be moderate because we divide this into 3. And there's 3 stages, mild, moderate, and severe. So this one has to be severe. So it's not indicated. So 1, 2, 3, and 4 are the one that is indicated. This is the question. I just put an NGM box around it to intimidate you, but we're learning. That is the process of watching this kind of video to learn something from it, to build confidence so that when you go take the NCLEX, you see, I've seen this before. Whatever they throw at me, I got you. Whatever they throw at me, Adapt NCLEX got me. That's why this is there. You know it already. I want to try to like make you think like you're taking exams. So if you're on this question, number 5, you made it through. You've done a good job. Let's continue number 5. What do you think? This one too is the same thing. It's building up on the previous question. And it's something I want you to take. There's a concept here. Which assessment would the nurse expect with the true labor, right? Select or apply. I could have put it in the box, but this is SATA. A nurse is assessing a client at 37 weeks who present to the labor and delivery unit for suspected labor. What do you think? Effacement, contraction from your lower back to the abdomen, contraction occurring 2 to 5 minutes, getting stronger, and contraction is relieved by walking and cervical dilation. I want you to write it down. Knowing the difference between true and false labor is a must if you're going to take the NCLEX or if you're in nursing school, because it's very common. They ask all the time. It show up on the NCLEX all the time based on what I hear from other people. And pregnancy stages, because these are something patients going to ask you. Therefore, I know what you're thinking. You know the answer. Show it to me in the comment. Now let's go. True labor means you are about to have a baby. And so it should progress. And the baby will come out if the cervix is what? Open. So effacement, that means it's getting thinner and thinner. Contraction is starting from the lower back, strong one, going to the pelvis. Baby is trying to push down. That's good. Those are the bars word. And the contraction are close to each other. Even if you don't know the time, this one is getting stronger. That means it's progressively getting worse. It's not the same. You cannot take it. The pain will not go away whether you walk, you take a medication. That's wrong. And whenever the baby is contracting, and whenever the uterus is contracting, the cervix should change, cervical dilation. Therefore, what are our right answer? We have effacement, we have pain coming from the lower back, we have contraction getting bigger, and then we have what? Cervical dilation. That means the only answer choice that is wrong is that. So this is the way we know that this is true labor. Number 5, halfway. What is your score so far? Let me know. Hashtag in the comment section. Let's go. Number 6, are you ready? Let's get going. Which medication the nurse should anticipate to be prioritized? This is a test-taking strategy, but I'm going to give you some content, and I want you to take a pen and paper. There's so many ways you can answer it. I know the answer choice you pick, but there's a concept here. Write it down. And nurse provide care for a client at 36 weeks gestation in preterm labor. Which medication the nurse should anticipate to be prioritized? Beta-medicine, Terbutaline, endomethacin, methotrexate. Which answer choice you want to pick? Let's break down the question, and then we can figure out what answer choice we should pick. Which medication should the nurse anticipate to be prioritized? Underlying prioritization. And nurse provide care for a client at 36 weeks. There's a reason why I give you 36 weeks. Patient is in what? Preterm labor. Preterm labor, that means you contraction before 37 weeks. Therefore, we know we got to do something about it. But there's a concept here. The time is changing it. We want to stop contraction. But 36 weeks is a major problem. Because of that, the right answer choice is 1. And why? Let's break it down. We know we want to stop contraction. Beta medicine does not stop contraction. It's used for fetal long development. Therefore, we're picking it for long development because the mommy is far ahead, just 1 more week. And therefore, it's okay to allow the long to develop because that's the most important. Now, the Terbutaline is going to slow down what? Contraction. That's what we use for preterm labor. But after 34 weeks, the use of it is more dangerous. It causes more fetal tachycardia, pulmonary edema, and electrolyte problem we saw in that question. You see, application. Therefore, we cannot use it. I'll give you a content right now. And the medicine, you don't use it after 32 weeks. The lady is in what? 36 weeks. It causes what? Closure of ductus arteriosus. Methotrexate is abortogenic. It's going to cause abortion. Therefore, the right answer is 1. But this is what I want you to write down. And that's the concept. This is the mnemonic. Steroid for the lung, tocilate for time. Tocilate is time. We use it based on time. But your steroid is going to improve your lung. What is the concept? If you're less than 34 weeks, yeah, we need to stop you so that we can allow your lung to develop. Because it takes time, right? But at 34 to 36 weeks, when we give you tocilate, it's going to cause more problem. Therefore, at that time, 34 going, you rather prioritize what? Lung function versus slowing down birth. Therefore, you don't use tocilate anymore. You hardly use it. After 37 weeks, you don't use it. But write it down. When you see a question about this, look at the weeks the mommy is in. 36 weeks, it's okay to give them steroid. Which next action should the nurse prioritize? A nurse obtain a positive fetal fibronectin test from a client at 29 weeks of gestation who report mild uterine contraction. What would you do? Reassure the client this is normal. Prepare the client for administration of beta medicine. Encourage ambulation to promote uterine circulation. Schedule a follow-up test in 2 weeks to confirm the results. This one, if you've never heard about it before, fetal fibronectin test. This is a common test they do all the time. Shows up on the NCLEX, easy answer choice, and I'm going to give you the content. But try and pick your answer choice. Think about the answers and think about which one makes sense. Test taking strategy, use it. Know how to answer the question. How to answer question. Even if you get it wrong, it's okay for me. I just want you to learn how to break down the question. The more you learn how to break the question, the more you get better at selecting the right answer. Therefore, let's get to it. If you have to pick one and you have no clue what this is, which one would you pick? I would like to know in the comment section. But I can tell you the right answer is number 2. Why? Let me show you. During development, the baby is trying to form a connection to the mother. This is the mother. This is the baby. The fetal maternal barrier. They need a glue. So there is something called fibronectin. Look at it. Nectin, connecting, fibro, connective tissue. So it's a connective tissue involving the placenta and establishment of fetal maternal circulation and attachment. During the beginning of forming, there's a leakage into the blood. So the level is high. So you can see it up to what? 22 weeks. That's all. After 22 weeks, there should be no fibronectin. It means the baby has established and there's no leakage. This should be like that until you're about to deliver, which is what? Greater than 37 weeks. So from 22 weeks to 37 weeks, there should be no fibronectin. If you see fibronectin, that means the glue is leaking. If the glue is leaking, the baby is going to come out. That is preterm labor. So presence of fibronectin means preterm labor between 22 to 37 weeks. Therefore, this lady at 29 weeks is having preterm labor. Based on that, you can tell that this is not normal. We should prepare for steroid. We should not let mommy walk because she's going to deliver. She does not need a follow-up. So that's the content. And I'm going to show you the mnemonic and you write it down. Fibronectin, 22 to 37 weeks means preterm labor. If you want to know the mnemonic, I call it FFN. Fetal fibronectin not staying put. It does not want to stay put when the fibronectin is high. Fetal fibronectin is not staying put. FFN. That's your mnemonic. Number 8, 2 more. And then assessing the client in labor, which finding indicate that the client is in active phase labor. This is all over again what we saw. I'm trying to go over so that you can see how the NCLEX will throw you back and forth. I show you how you can divide it into 3. Contraction lasting 10 to 30 seconds and irregular. Cervix, 5 centimeters. Contraction every 3 to 5 minutes. Strong edge to push with contraction every 2 minutes. There's a copious blood show and irritability. What is your answer? Let me know in the comments. But I can tell you the right answer is what? Number 2. Why? We can take a look at it. Contraction lasting every 10 to 30 seconds and is irregular. Irregular tells you it's not really progressing the way it's supposed to, and it's very short. This is the beginning, latent stage. You don't know anything going on. 5 centimeter is what within the range we talk about. Divide the 10 into 3. And 10 to 3, you're going to be in the active phase. And the contraction are regular every 3 to 5 minutes. That's better. Strong edge to push, that's the buzzword. Is what? Ferguson reflex. And that okay, transition phase. Copious amount of blood. I know a lot of people will pick number 4. This is blood show. It has nothing to do with active phase. Most of the time, transition phase. So know these little buzzwords, and that is what will make labor and delivery straightforward for you. If you need more, I will link a bunch of labor and delivery videos, a comprehensive ones, and you can watch it. But this is test-taking strategy, labor and delivery, English practice question on maternity nursing to help you pass your NCLEX nursing school. So 5 to 7 centimeter dilated is active phase, and that's the right answer. Number 9, and is caring for a client 38 weeks. Every time look at a week given who is undergoing amniotomy. That means we're trying to rupture the memory because the mommy is not rupturing her own memory. So it is artificial rupture of memory. Which action should the nurse prioritize after the procedure? After the procedure, what would you do? Do you monitor for the heart temperature? Do you monitor mommy's lungs? Do you place mommy in the knee to chest position, or you place the client in the side lane? Stop the video as usual and show me which one you will pick. And now let's break down the answer choice. Let's break it down. What is the answer? The right answer is number 3. Why? Let's break it down. When you have amniotomy, basically, when you break your water, what is going to leak? Fluid. And when the fluid leaks, it's going to push the placenta. When the placenta gets pushed, the easy way is to come down, and it causes cord prolapse. In the process, baby is going to have what? Fetal bradycardia. And therefore, monitoring temperature is important. It's very important. Why? Because we worry about infection. Artificial rupture of the memory, it can lead to prolonged labor if the mommy doesn't progress, and the mommy can have coronary amnitis. That's bad. Sepsis to the baby. Checking for maternal lung is a trap. A lot of people will pick lung because they see lung, but it has nothing to do with what? Mommy, amniotomy, the only thing mommy will have is a mild abdominal pain. It's all about the baby. Everything is about the baby at this situation. Therefore, if we know cord prolapse is going to happen, what are we going to do? We're going to assess for that and treat it. How are you going to assess for that? Do you place mommy in the lateral position, or you place mommy in the knee to chest position? Knee to chest position is the right way to go for cord prolapse. That's why number 3 is the right answer. And the last one. And this is caring for a client in what? Active labor. This is putting everything together. The client is what? 7 centimeter dilated, 100% effaced, and the fetus is in 1+1 station, trying to come out. The client reports strong contraction every 3 minutes, lasting 60 seconds. So in sync with what we should expect. What would you do? Encourage the client to start pushing right away, breathing support, prepare for delivery, and place the client in a supine position. There's a bunch of keywords in the question. Don't run away from it. Let's get it. let's try and find them. The client has strong contraction every 3 minutes and lasting very short. It's getting closer. Why? 7 centimeter dilated and 100%. Even though it's 100% in phase, 7 centimeter dilated is still not in the transition zone. This patient is in active phase. Therefore, what do you do? What would you do? Pushing is when you're about to have the baby, not in the active phase. You've not get to the transition phase yet. Even at the transition phase, you wait at the last stage of the transition phase until you get to the second stage and you can do the pushing. Breathing technique is what you provide for the mother. And so that's the right answer. At this stage, we're not ready to push yet. There's no need for immediate delivery of the baby because we are in active phase. This question requires you to find the active phase, find the numbers given, and you know that we are in the active phase. Supine position is no. No pregnant lady should be in the supine position. Therefore, number 2 is the right answer. 10 questions, NCLEX practice questions on labor and delivery nursing. We talk about active labors. We talk about transition labors. We try to talk about things we need to see in Ferguson reaction. We connect everything together in NGN form to make labor and delivery easy. We talk about terbutaline. These are high yield facts you should know and write them down. Thank you for watching. If this video helped you understand labor and delivery, put down a comment in the comment section and subscribe to Adapt NCLEX for more content like that and share the video to your friends. Thank you for watching and good luck. And don't stop charging. Keep charging as always. Good luck.